1 out of every 28 women in India are at risk of developing breast cancer. Though it is only more common in women, yes, it is possible in men. Only 15% of the breast cancer in India are diagnosed when they are at a local stage. Others are already spread to other organs. That now we are able to diagnose them more easily. We have more tests available. Even people are coming forward. So everyone above the age of 20 do self-breast examination every month. Okay, it's very easy. Welcome to my channel. I'm Dr. Jill, and today we have with us our favorite dermatologist and pathologist, Dr. Geetha V, who has gracefully accepted to join us again and talk about this very important cancer. Thank you, ma'am. Welcome again.
Hello, Mamta. Thank you.
Today we are going to talk about the most common cancer in the world, which is breast cancer. Yes, breast cancer is the most common cancer in the world today.
That is carcinoma breast. It is breast cancer.
Till recently, lung cancer was the most common cancer in the world, but in 2021, according to a survey from an international organization, now breast cancer has overtaken even lung cancer. Though it is only more common in women, yes, it is possible in men, but it is more common in women, but still it has become the leading cause of cancer in the world. What are your thoughts about this, ma'am?
Yeah. Previously, lung cancer was the first one, but now this carcinoma breast is the leading carcinoma cancer in the world.
Ma'am, why the breast cancer cases have increased so much?
So many reasons for that. Like we can consider genetic mutations. So many genetic mutations. Some genes like BRCA1, BRCA2, some mutations of these genes may lead to the carcinoma breast, and environmental factors, dietary factors, hormones. Okay. Nowadays the diagnostic methods are more. So we are diagnosing easily carcinoma breast. So that could be also one of the reasons.
Actually, the lifestyle, unhealthy diet and lack of physical activity is the root cause of all the non-communicable disease, and cancer is no exception. We can find cancer occurs more among people who do not take a good diet, who are taking more of junk food and do not have fresh food, like do not consume more of vegetables and fruits, or who do not do exercise, who are obese or are overweight. Those people are getting more cancers also. And as ma'am rightly pointed out, that now we are able to diagnose them more easily. We have more tests available. Even people are coming forward. Earlier people used to hide them more. Even today, ma'am, like the statistics say that only 15% of the breast cancer in India are diagnosed when they are at a local stage. Others are already, they have become enlarged or even spread to other organs. So the situation is not good even today in India.
What you said is 100% correct, but nowadays a little bit awareness is there. So people are approaching their physician and their concerned OBG person. If they notice any problem, if they notice a little bit change in their breast, like a little small pain also, if they get pain, menstrual, like cyclical pain is a normal phenomenon, but still people are approaching. There is a little bit awareness, and in rural India still awareness has to be undergone. Like there should be awareness.
How can we identify breast cancer, ma'am? How does it all start? What are some of the signs or symptoms?
There is a lump, which usually painless lump. Okay, and it is fixed to the breast tissue. It's not moving. Okay, and if there is any discharge from the nipple other than milk, okay, and any serious discharge, and if there is any eczematous condition over the nipple, like we should suspect cancer, and also if there is any redness, and but there is no pain, but a little bit red skin. Okay, that may also clinches the diagnosis. And some people will have axillary lymph nodes, that is underarm. If there will be swelling, the swelling is nothing but lymph nodes. So you should think something is wrong with their breast. These are all the most common things. And apart from this, you can also think about their family history. Okay? Family history is very important. So this is more common in first degree relatives who suffer carcinoma breast. and it runs in the family. They are more prone to develop this carcinoma of breast. And early age of menarche, like it is something hormone related, estrogen related. So early menarche, late menopause also may sometimes precipitate. And breastfeeding also has got common mistake. Nulliparous women are more prone to develop carcinoma of breast. Parous women less likely.
Okay, so the women who breastfeed or the women who have children are at lesser risk than the women who are nulliparous, means who do not have children or who have not breastfed. So this may be one of the protective factors for breast cancer. And also you should not think that no, I do not have any relative who has breast cancer, so I do not have risk. So 90% of the cancers are not genetic related also. So we can say that 10% of the cases which we are getting are having a history of breast cancer in their aunt, in their mother, in their sister, but 90% do not have. So it can be sporadic also, it can be randomly in some person also. So do not think that you do not have the risk of breast cancer. And as ma'am said, there are many signs and symptoms. It may be a lump, okay, it may be a lump in your breast. It may be painful, it may not be painful, and you should not ignore the signs related to the nipples. Sometimes the only thing which you see is the redness of a nipple or discharge. So any discharge other than milk is not normal. So if you are getting such a discharge, then you should talk to your doctor. So ma'am, what can we do to diagnose it early, or what is our role? Can we do something at home also to decrease our risk?
Yeah. Like self-examination, self-breast examination will say, that is mandatory. What they recommend is below 35 years they should examine regularly, like monthly once, like that. And after 35, once in every week is mandatory. They have to self-examination. So if they notice any other like symptoms which I have told you, any lump, if you notice any discoloration, any discharge, you have to approach the nearby doctor.
The self-breast examination, so you have to feel with the flat of the hand.
Yeah.
You do not have to use the tips of the fingers. The flat of the hand is very good in diagnosing any lumps. And remember that your breast tissue is till your axilla. It does not stop at the breast. It goes till your armpit. So if you are finding any lump or any swelling till your armpit also, it can be related to breast, and it can be breast cancer or just a lump or swollen lymph node because of something related to the breast. So do not ignore that also.
So normally it is a common thing, if you notice any lump, people may feel that they are having some problem. Yeah, it is really a concerned problem, but still I can say in younger age group you may see some lumps, you may find out some lumps. Those are all benign lumps, they are freely mobile. And sometimes you get cyclical mastalgia, means they'll have pain before or after the menstruation because of hormonal effect. So people should not worry about all these minor signs, but if they get repeatedly, if the pain is unbearable, if the lump is fixed to the breast tissue, then you should approach your nearby physician.
So see, the breast is very much dependent on estrogen and progesterone. So as in our cycle, the hormones increase, the hormones decrease. So that is how sometimes at some stage of the month we may get pain in the breast, which resolves automatically with our menstruation or after the menstruation. So if your pain is like this, cyclical, means every month it is coming, then it is going. So that may be related to the hormones and your menstruation. But if it is not that, and if it is too much and if it is getting repeated, then you have to contact your doctor. It may be another cause. Okay, ma'am. Ma'am, what about clinical breast examination? When should we consider going to a doctor and get ourselves examined?
Like if you notice a lump, whether it is a benign lump or malignant lump, and if you notice it is mobile, still you have to approach a doctor, a physician. No, what the physician role is, they'll check. They'll find out whether it's a benign thing or whether it is a malignant one. And if they don't get any conclusion, they'll ask for certain investigations like mammogram, fine needle aspiration cytology, FNAC, and above that biopsy. And if at all required, MRI also.
Okay.
And ultrasound guided MRI. Ultrasound as well as MRI, both. So these are all the different methods of diagnosing this carcinoma of breast.
So self-breast examination is very important. Not that it can always diagnose your cancer. Sometimes you may miss it, even if you do self-breast examination. But at least it is one tool to find out. Because women have started self-breast examination, we are able to diagnose more cases at an early stage. Early stage diagnosis means you can get treated, your lifespan will be longer and the quality of life will be better. If you diagnose someone who already has a big lump, already the cancer has spread to the spine or to the lungs, then nothing much can be done for them, and this is bad. Okay, so never ignore any lump in your breast. Never think that no, I do not have cancer. 1 out of every 28 women in India are at risk of developing breast cancer. So do not ignore it. Do not feel shame about it. It's your health. If you get cancer, you are the one who is going to suffer. So there is no use in feeling shame. It's our body. We have to take care of it.
That is true. So still in rural India, people, I don't know whether they'll feel shy and they think it as a stigma. And so there are so many various reasons, because they won't be having sufficient time to examine themselves. So these are all the reasons. So we should create some awareness programs to them, to how to examine, self-examination, like what are the different types to examine their breast, and what are all the different modalities of this diagnostic. And awareness programs have to be increased. That's what I say.
So everyone above the age of 20 do self-breast examination every month. Okay, it's very easy. I will give you a link in the description how to do it.
These investigations also, initially the physician will examine the breast, and after that, if at all necessary, they do ask for you to undergo mammogram in age group below 35 years. If above 35 years, mammogram is a mandatory thing, and followed by FNAC, either FNAC or biopsy. Okay. And above 45 years, core biopsy is needed. True cut biopsy or core biopsy, they will say. If at all they notice any lump, core biopsy, mammogram, and if at all necessary, MRI is also required. So as the age advances, there are more chances of developing carcinoma of breast.
Yes, ma'am. So no age is safe of breast cancer, and in India it is seen that the breast cancer has 2 peaks. First it peaks at around 45 years of age, and later it peaks at around 65 years of age. So younger women as well as older women have risk of developing breast cancer. So whatever age you are, if you find a lump, do not ignore it. Okay, and that will assure you a healthy and longer happy life. So we thank Dr. Geetha V to spare her precious time with us. Thank you so much, ma'am.
Thank you, Mamita. Thank you all for watching this video. Thank you very
I
much.
hope you all will benefit. Thank you so much.